want to share with you a little bit of an anecdote and a story here. First of all, I want you to think about maybe some of the goals that you hopefully set forth or you're thinking about for yourself in terms of your own wellness goals. And to get these really concrete, this is for the participants, also for you, Ricky and Wayne. And understand something that comes to mind for me is whatever your political affiliation, I'm going to quote Barack Obama here, something he said, and whatever whatever your political affiliation is, I think we can probably most of us agree that this is somebody who had a good command of language. He could describe things really well, or had great speech writers. And one of the things he said when he was running was that, and there was a lot of frenzy around and excitement around him, is that he said, you are the ones that you have been waiting for. Speaking to his people, you are the ones that you have been waiting for. So while you can get help, and I often think this when I'm sitting with clients, while you can get help and you can seek help from professionals, ultimately it's me helping people tap into their own wisdom. So frequently we know what it is that we need to do. We intuitively know it, right? But there are things from our past, ideas about how we feel about ourselves, how we relate to our own work, how we relate to our own health, that stops us, right? We need to break those things open and examine them, okay? We know that mental health is often misunderstood. Sometimes there's a stigma around it, but more and more, especially as I'm working with, and probably all of you, working with younger generations of folks. I'm 51, but when I have somebody who's in their 20s come on in, oftentimes they've been talking about mental health their entire lives. And it's something that is endemic into their systems and their upbringing. It should be that case for all of us. We want you to be able to make good decisions for your mental health every single day. And I put down a couple of different steps that you can take here at the end of this slide, which is we want you to assess your mental health honestly and openly with yourself and other people. I want you to set goals for yourself in terms of improving your mental health by making it a priority. I want you to create a plan and then execute it, okay? And holding yourself accountable, getting other people to hold you accountable, which is why we're telling you to potentially make things public, what your goals might be. So tell other people about what it is that you're trying to do. Start off small, start off simple, and get professional help if you are stuck. And that doesn't need to be from a psychologist, although I happen to be an advocate of the mental health field. It can be from a friend, it can be from a mentor, it can be from a colleague, from a partner, somebody that you trust, somebody that you know and understand, somebody who has wisdom. For the history of humankind, most people have figured out their problems without necessarily running to doctors, right? But doctors are here for you, mental health professionals are here for you, and please don't hesitate to use them. It's really important. If we can go on to the next couple of slides here. Okay, so at the end of this, we have put down some resources that you can take advantage of. These you can look on at your own time. I'd rather get to some of the questions, but these are fairly self-explanatory. And EAP programs, healthcare benefits, support groups that you might be able to find. We put down some mindfulness resources there. You can Google them and find some of that information. You're a therapist or a counselor that you can trust. Let's go to the next slide here. A couple of other suggestions right here on this slide, which really we have gone over. So just look at those at your own time. Let's go to the next slide. We could. Clearly, when our mental health breaks down and we do feel like we are that cooked frog, if you will, sometimes we really need immediate help. And it's, I was trained, and I firmly believe that talking about things like self-harm and suicide, we should be talking about those things overtly. I help run a suicide prevention organization for working age adults here in Denver. And one of the things we learned, and this is based on research, is don't be afraid to ask somebody, have you been thinking about hurting yourself? Are you feeling suicidal? These are things that are not going to prompt someone to have more difficulty. It's actually going to help them. So if you or someone else you know is in great distress, please, here's some resources available for you. Let's go on to the next slide. And just as a reminder, this webinar is being recorded, and the slide deck will be available, be sent to you after this. Finally, some additional resources, primarily from the Mayo Clinic, exercise and stress, information about that, relaxation techniques, mindfulness exercises, and a little bit on job burnout. Mayo Clinic's a wonderful resource. You can click on those. They'll give you the links here.
Please subscribe and check out more content from us.